Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great video for those of you with lower back spondylolisthesis. We're going to be talking about sway back posture, how common it is, and how often it's related to lower back spondylolisthesis pain, as well as what you can do to start correcting some basic movements like leaning backwards without aggravating yourself. Hope you enjoy. So sway back posture is where the hips are more forward than the shoulders and the ankles. In normal standing posture, we should have a vertical line between the ankles, hips, shoulder, and ear. Sway back occurs because the gluteal muscles and core muscles in the body get weak and the person stands with their hips more forward. Now, hips forward is a normal part of bending backwards. And for those with spondylolisthesis pain in their lower back, many times spondylo is going to be aggravated with too much arching backwards or increasing the curve or lordosis in the lower back. When we have sway back posture and we lean backwards to do something, the hips many times have a tendency to lean too far forwards, more than 10 centimeters or 4 inches. As a result of that, the pelvis can't go into its normal anterior pelvic tilt. Now, for those of you who have seen our videos before on the channel about spondylolisthesis, you may realize that anterior pelvic tilt by itself many times increases the lower back arch and drives that lower vertebra forward, increasing spondylolisthesis pain. However, some degree of anterior pelvic tilt is important when we lean back, because normal leaning backwards happens at a number of different areas. It happens in our mid-back between our shoulder blades of the thoracic spine. It happens across the entire low back spine, all 5 vertebrae. It happens when the pelvis moves forward less than 4 inches, which creates extension at the hip, or it brings the leg back from the hip socket in relation to the rest of the upper body. And it also relies on the fact of the pelvis tilting forward slightly. Now, if your hips move forward in sway back posture, you're going to notice it's a lot less likely to tilt your pelvis forward. If you practice a normal posture with your hips back under your shoulders, you can anterior tilt. You can drop your pubic bone and raise your tailbone. But when the hips are forward, it's very difficult to do. So what happens is in sway back posture, as the hips come forward, we lose that ability to anterior pelvic tilt because the body gets locked with fascial pulling in this area. And as a result, our lower backs cannot increase the extension or the arch throughout the entire lower back. And so what happens is the extension is magnified in the lower part of the lower back, L3, L4, and especially at L5, S1, creating not only extension or an arch, but it also drives that vertebra more forward. It's an anterior shearing problem. And if you've seen our videos before on the channel, you realize that that's a big part of spondylolisthesis pain. So again, we're looking at the body trying to get all these units that extend or lean us back in one action, having each part successfully contribute to their part. People with mid-back tightness, because they slump forward all the time and they lack extension in their mid-back, are going to be likely to do this too. People with sway back posture, they're going to be likely to have a problem, because anytime you get tightness in these other places that are supposed to extend, like the pelvis rocking anteriorly or the mid-back bending backwards, or even let's say the hip extends because of tight hip flexor muscles, that lower back itself is going to want to arch too much, especially at the bottom. So how do we correct this? Let's talk about a few great exercises and stretches to help undo the effects of sway back posture on low back spondylolisthesis pain. So the first thing you want to check is to make sure you have normal hip extension motion. Normally with the pelvis in neutral without anterior tilting, the hip should be able to go back, or the leg should be able to go back about 20 to 30 degrees. If the hip flexors are tight, you'll feel an overall tension in here and you won't have that range of motion. Some stretches that'll help. You can bring one leg back with one leg forward. That's a general hip flexor stretch, feeling in the front of the thigh. As you do this, make sure your tailbone is under so you don't go into an anterior pelvic tilt. Just hold a little tail tuck under between your legs and you feel that stretch in the front of the groin. This is a general hip flexor stretch. The psoas, the TFL, the ITB, hip adductors, rectus femoris are all getting a little stretch. To target the individual stretches to these specific muscles, you could, number one, from this position, bring your legs slightly across the midline. That'll target the tensor fasciae lata, or TFL, more on the side of the hip, as well as the IT band. You can bring the leg out further from the midline and that'll stretch the front adductors or anterior adductors that contribute to hip flexion. And you can also target the rectus femoris, the quad muscle, by tucking your tail under first and then grabbing your heel and bringing the heel towards the buttock. All of these stretches should be done for a minimum of 15 seconds, preferably held until the feeling of stretch disappears, and then brought a little further into the range of motion until you feel the mild stretch sensation again. Remember, if you have a heavy stretch, the body won't release. A light stretch, you won't excite the muscle spindles that protect the muscle by tightening, and you'll get a much better stretch. Working on increasing the extension of your mid-back or thoracic spine between your shoulder blades is also very important for sway back postures, because if the mid-back doesn't extend, the hips have to go further forward trying to get that extension when we lean back to do something from other areas in the body, such as the lower back, especially in the low back, L5S1, L4-5. So to increase thoracic extension, which undoes the slumping posture of all day long, number one, start trying to sit up more erect when you're driving, when you're working at your desk, even when you're standing, and avoid that slump posture. To target the stretch, you can do it standing by standing against something, let's say your hips against a bar, and making sure that your hips don't go forward, and keep one hand in your lower back. That's to make sure that the arch in your back is staying at a specific level of arch and not increasing as you raise your shoulders backwards. Now, as I do this, and my shoulders come away from the wall or the bar that I'm standing at, I'm monitoring my lower back to make sure that it's not increasing its arch, but all the arching is coming from my mid-back. I can do that standing. I can also do that laying down on an exercise bench, where here my lower back and hips, as well as my legs, are blocked by the bench, and I'm simply trying to raise up. Again, I can put my hand in my lower back to make sure that that arch doesn't increase in my lower back, and try to raise up from my mid-back. And you could do that for repetitions to stretch it out, or you could maintain that position for prolonged periods of time to increase that thoracic stretch. This position is also great for increasing the muscular forces and your endurance strength of undoing sway back posture. So from this position, when I keep my chest down, the second exercise I can do is to simply raise my hips up. Now, you want to make sure that you have enough pelvic tilt in either direction and that you're comfortable. So if you tilt your tailbone up to increase the arch in your back, at a certain point you'll feel lower back pain. And if you tilt the tail under to flatten the arch in your back, you may also feel a little pull in your back. So ideally, your neutral amount of pelvic tilt wants to be halfway between those two extremes. Once this is held, you're going to pull your hips straight up, hold for a few seconds, and then down. If you notice, this is the exact opposite motion of sway back posture. Here, my hips are moving behind my ankle and my shoulder, and I'm increasing the muscular endurance of pulling myself back. As well, I'm stretching the body in the opposite direction from what it usually has when I'm standing in sway back posture and my hips are more forward than my knees or my shoulders. So if you start putting these together, you can then practice bending backwards without increasing that anterior translation and that increased arch at L5S1 or L4-5, which is the most common locations of spondylolisthesis in the lower back. And the way you do this is, number one, you'd set yourself in that anterior pelvic tilt and posterior pelvic tilt range of motion that's most comfortable, or neutral position. Again, tail up till I feel a little discomfort, tail under I feel a little discomfort. I want to be right halfway between those two. When I'm in that position then, I want to allow my hips to come forward just a little tiny bit. I can use my hands, a light pressure, but I want to have more increase of a slight anterior pelvic tilt, not as far as it takes for me to feel pain though. Remember, we already discovered how much range of motion causes pain. So here you'll be working in what's known as a neutral spine range of motion, or a neutral range that doesn't cause pain. So you have a little anterior pelvic tilt. That's going to allow the entire lower back to start arching, not just low down at L5S1. And I'm going to try to lean back from my mid-back, practicing like I was with that exercise standing or laying down, so in between my shoulder blade leans back. And I can have my hips come forward a little bit, but try to shorten the typical amount that they want to slide forward. And by doing this, by increasing that anterior pelvic tilt within your range, increasing thoracic or mid-back extension, and trying to slow down or limit or break the hips from sliding forward as much, I'll be able to look up and do things now without causing that undue stress at L5S1 and relieve my spondylolisthesis pain. Practicing these stretches and exercises can help those with spondylolisthesis and sway back posture go a long way to performing daily activities such as reaching up, bending backwards without repetitively stressing their back pain. Remember, most back pain is not a result of a one-time cause, but usually a repetitive micro-trauma that occurs over many, many months and years that slowly wears out joints, discs, cartilage, and puts stress and strain, resulting in the usual pain. If you'd like to learn more exercises for spondylolisthesis, check out our low back spondylolisthesis fast track program available at painfreeandfit.com. It has all the exercises, stretches, a body analysis to figure out what your mechanical errors are that cause your pain, and it guides you step by step in developing a program to help undo the mechanical stresses that you're putting on your lower back and help you get out of pain while still getting fit with spondylolisthesis. I hope you've enjoyed this video on spondylolisthesis and sway back posture and extension, and it helps in your chronic low back spondylolisthesis pain.